Good afternoon from the 1011 Now streaming studio. I'm Danielle Shenk. This is Inside the Story with the Flatwater Free Press, a nonprofit news organization in Nebraska that focuses on investigative and feature stories. Today, we're sitting down with reporter Chris Bowling to discuss how state audits are impacting Nebraska's mental health professionals and their ability to offer Medicaid. Thanks for being here, Chris.
Yeah, thanks for having me.
Alrighty, so first, can you kind of share how this issue first came to your attention and what led to the rise of these aggressive audits, Medicaid audits?
Yeah, so we first heard about it through our tip line, where we hear about a lot of different stories, and it was basically just some therapists who use Medicaid were saying that they have noticed an uptick in these aggressive audits, basically the long and short of it is, they think that the companies that oversee Nebraska's Medicaid program have instituted a more aggressive and less forgiving system than they might have in the past for audits. The state says nothing has really changed, and these audits are really important to protecting taxpayer money. But yeah, definitely a very interesting issue.
Right. And so your article mentions auditors are using a new system that kind of streamlines the organization and fraud detection, but has that kind of eliminated the human element that's important for the review process for audits?
To hear the therapists and the providers I talk about it, they think yes, that in the past, they might have worked with a clinician or someone who had experience, doing the kind of work they did, looking over their stuff and being like, hey, make this correction and do this, do that. You're doing a good job. Don't worry about it. Lots of people I talked to had been through audits before and it had been completely fine. Now they feel like it's sort of a pass fail system. Like if you make any of these mistakes, they feel like, oh, you're automatically going to be asked to pay back a bunch of money. That's what they contend. Once again, with the state, they say that hasn't changed, that their process still includes, clinicians looking over documents, the state overseeing, the work that the Medicaid companies are doing. So, again, there's always two sides to every story. One side says that it has no nuance anymore and that people are just getting hammered left and right, and the state says that's not happening. So, yeah.
Mm-hmm. And so the state kind of argues that these audits are routine and necessary to protect the taxpayers of Nebraska. But what's their justification when providers are saying it's more about clawing back the money?
Really just that these are important parts of like the system is important to making sure that there's not fraud, waste, and abuse happening. They didn't want to comment on specific cases. When I was reporting the story, the providers are very afraid of retaliation, so they weren't exactly wanting me to share their names with the Medicaid companies or anything like that. So I don't know. I guess from the state's perspective, it's just the system working the way it should, that this is an important thing to make sure that we don't have fraud, waste, and abuse. I mean, they sent me who had been billing for phony clients and things like that. So a lot of the providers I talked to said that their clients were not interviewed, though, that had their clients been interviewed, they would have told the auditors that, uh, the services they were receiving were really important.
Mm-hmm. And so there is kind of this contradictory measure here happening that in this graph that you have, and a little explanation there is that Medicaid providers are seeing a steady climb, but the number of mental health professionals that are wanting to be a part of Medicaid is declining. So there's kind of this rift there.
Mm-hmm.
Can you talk a little bit more about that?
Yeah, I don't know. I think that might be something that we might need to watch for the next like couple of years potentially. I mean, one thing that's important to note is that this data that the department shared with me, the rise in providers, I mean, those are thousands of people. The survey that the Nebraska chapter for the National Association of Social Workers did, that's only 162 providers. So a smaller sample size on the survey, but the fact that 20% of those people are saying that they want out. And you never know. Maybe the people that took that survey at that time, they were, I really don't like this system and I don't want to work in it. But when push comes to shove, it's a lot easier to say, I'm never going to do this again. I'm leaving this rather than, actually doing it. I think everybody's had a job that they're like, I really want to quit this job. But then when push comes to shove, you're like, well, I'll put up with it for a little while longer. So I could, potentially in the next couple of years, if this is a bigger trend than just a small handful of providers, maybe that leads to some change. Maybe it doesn't. But yeah, it can be a little bit contradictory.
Mm-hmm. And so I want to talk a little bit more about this other graph that you have here where it says
Mm-hmm.
more audits, less money. So kind of talk about how the audits have seemed to be changing a little bit.
Yeah. So also data from the Department of Health and Human Services. Basically, yeah, there's two columns. There is the number of audits that they did, and then there's also the amount of money they collected. And you just divide, the amount of money they collected by the number of audits, and you see that the amount of money that they're collecting is shrinking. That's that line graph. So this the providers would say is evidence that hey, the big Medicaid companies, the state is paying. We have three Medicaid companies that manage our state's Medicaid program. Each is being paid $4.25 billion for the next 6 years to oversee the program. So big companies that are coming after really small providers who don't have the tools to fight back, collecting small amounts of money because they know they can get it. That's what the providers say. The state says that the reason that per case dollar amount is going down is because during the pandemic, there were a lot of providers who were barred from the Medicaid program who wanted back in. And to get them back in, the state needs to investigate them and make sure that they're, following compliance, that they're worthy of being let back in. Those are fraud investigations, or I don't know how they would phrase them, but basically they're fraud investigations that don't carry any monetary total. And those were prioritized during the pandemic. So the state says we just did a lot more investigations, but we weren't clawing back money for all of those. So again, kind of confusing to know exactly, what is going on there. But each side, can definitely, make a case for the point they want to draw from it.
Right. And so you did talk to quite a few providers throughout this
Mm-hmm.
article. Can you kind of talk about how this is impacting them financially and emotionally?
Oh, yeah. So, I mean, a lot of them, I think the majority of them are either individuals or like really small practices. So, they're not bringing in a whole lot of money. I mean, I think they're doing all right for themselves. But when you get, a letter in the mail that says you need to pay back $20,000, $30,000, almost $40,000 in 30 days, that is, I mean, I think most of us would say, how can I do that? I don't have that kind of money sitting around. Um, so that's one thing. The other thing is that a lot of these folks told me that, they had passed audits in the past. And so there's a lot of questions of, why did I fail this time? And then the explanations don't really make sense and they can't seem to really get answers. And yeah, I think working with Medicaid clients in general, it sounds like it's a lot more, difficult. People are bringing, issues like, trauma or, attachment issues, like problems with, close members of their family, things of that nature. So it's really intense work, and you build, really deep relationships with these people. You work with them a long time. And so to have to face that of like, am I going to get rid of Medicaid because I don't like this system and it's costing me all this money, but then I'm kind of, leaving my clients, without a provider potentially. I mean, they could probably, especially like in a place like Omaha or Lincoln, there's, a lot of providers, but if you go out to more of those rural communities, that can be a lot more difficult. So yeah, I mean, I think it's a lot of things. I mean, the financial aspect of it is really difficult. And then just trying to figure out this system. I think anyone who has ever had like medical debt and has had tried to like, get answers out of like an insurance company can probably relate to what these people are going through.
Mm-hmm. And so, when it comes to these audits and kind of the system, have the providers said that it's coming down more to like sort of technicalities, or is it, and they're not really focusing on the quality of care, or do the providers have some ethical concerns when it comes down to all
Oh
this?
yeah, I mean yeah, 100%. I mean the providers think that this is completely unethical. That this is about I can't remember. There's a quote in there somewhere about this isn't about the care we're providing, but it's about money. Or the quote's in there somewhere. But basically, I mean the main thing that they feel like they're getting flagged for is for having sessions that last longer than 53 minutes. You can bill. They're literally like God, I want to say it's like 42 to 52 minutes or maybe 40 to 52 minutes. And then, I mean, it's very, very like specific and they're billing for 53 minutes or longer, which, most people who go through to therapy sessions, I think they normally last about an hour. I didn't think that that would be such a big issue, but all of them, that's a commonality. They think they're getting flagged in the system and they're being put under extra scrutiny because of that time limit. And then, yeah, them saying they didn't talk to my clients, they don't care. It's not like they're saying they lied or anything like that. They're just saying, hey, you're missing this documentation or this is labeled incorrectly or something like that. Things that in the past they might have gotten a reminder, hey, make sure you're doing this or doing that. But it just comes down to like, are we saying that that they didn't do their job? Are we saying that they need to do their job better? I mean, from their standpoint, they range from very confused to extremely angry and kind of feel like they're running into a wall trying to get answers about why exactly this happened.
Right. And so, for the providers that kind of said they have had enough with Medicare or Medicaid,
Mm-hmm.
and they're going away from it, what have they? How has that kind of impacted the relationships they've had with longtime clients after making that decision to cancel Medicaid
Yeah.
contracts?
I think all of them that I talked to at least tried to phase it out in a really thoughtful way. So letting them know upfront and far in advance, like, hey, I'm transitioning away from Medicaid. Let me find you another provider, or I think some of them have transitioned to like a out of pocket system that somehow has a sliding scale. Like people are, I mean, there's a movement, across America, really, of a lot of people who are kind of leaving Medicaid or leaving insurance in general just because of a lot of these bureaucratic kind of hurdles and going toward different models. So anyway, to answer your question, though, I think a lot of people phase it out over a long period of time or are trying to figure out another system. But for the people, it's more the people that haven't left yet that I think are really struggling to, what exactly are we going to do? Because they might be working with more people that don't have other options. So it's a really tricky decision, no matter what way they look at it.
Mm-hmm. And so, what kind of training or resources, if there are any, does the state or contractors offer to help providers avoid some of these audit issues?
Yeah, so the different companies do have resources online, and some training courses and things like that. What the providers told me is they don't feel like the training resources are, comprehensive enough, or they don't answer these questions about, the thing I heard over and over again is we want to be in compliance. So, tell us what compliance looks like. Like, what does a model case note or document or whatever look like? And what they told me is that, they aren't getting those answers. That they're kind of getting like, well, we don't want to say because it kind of depends, from the insurance companies, and so yeah, I don't know. Another one of those things where and the Medicaid providers are responsible for training, people on compliance and making sure, and then they have these long handbooks and things like that online. But it's just the kind of thing whenever you're working with any sort of really bureaucratic system where it's a lot of information. It can be really hard to decipher. And especially when you're a small provider, they just feel even more like they're kind of crushed under the weight of all this different stuff. And even the ones who think they have a handle on it feel like there's the answers that they need are not there.
Right. And so, why is this so important when it comes to just the need for mental health resources here in Nebraska and how this is affecting the availability of those?
Yeah, well, I mean, I think most people should know that Nebraska doesn't have enough mental health workers in our state, particularly in rural areas. And, Medicaid, people with Medicaid, especially when they have mental health issues, there's a lot more acuity. There's a lot more serious issues sometimes that people are dealing with. You're dealing with a lot of trauma, kind of like I said earlier. So mental health stuff can be a very necessary component for people, whether you have Medicaid or not. So I would say that losing providers in any way, in any capacity, whether it's Medicaid or private insurance, that can be really difficult, having less options. I mean, if anyone's tried to schedule, a sit down with a therapist in the last few years, especially since COVID, there's long wait times. So I would say anytime you're losing providers instead of gaining them, if that's going to end up being the case, I mean, maybe it's the case that this is a really small collection of auditors that are not providers that are not indicative of the entire base. But, we've had a few emails already from other providers who are like, oh, I thought I was the only one going through this. So I think only time will tell. And especially we'll be watching the legislative session to see the discussion around this. If any, bills get introduced or there's any changes made, we'll definitely be keeping an eye on that.
Mm-hmm. And as we kind of wrap up here, you did mention throughout your article that Senator John Frederickson might have a proposal for something like this, and then maybe even a nonprofit is getting started around this. Can you kind of talk about both of those?
Yeah. So, one of the key things here is that the state does have a law, outlining how audits are supposed to work. And one of those laws is that you're not supposed to be able to request more than 200 pages, in an audit. And the state says that law does not apply to the Medicaid companies. So there are people who are sending hundreds, if not thousands of pages for an audit, which, that takes a lot of time to put together, and making sure that you've got it all right, that you're not sharing information that shouldn't be shared, all that stuff. It's a lot. So and there's a couple other things too that they feel are, loopholes in the state law that need to be addressed. So that would be the one thing that I would most be looking for, is how they're going to update, the state law around these audits. And then, as far as the nonprofit, Maureen Dureich, who's a Lincoln provider, she and a lot of other providers see things that are happening. I mean, the companies that manage our Medicaid system are, massive, like some of the largest healthcare companies in the world. So they see similar programs in other states, and some of these providers are seeing, issues here in Nebraska popping up, in states like Michigan was one that they told me about. So the nonprofit side of things, I think they are pretty ambitious about, like they want to try to see whether or not there's some commonalities of this happening in other states and figure out a way to advocate for, and work together. Because, it's hard. A lot of the providers are, I think it's like that they're self-employed, so they can't technically unionize. And so working through this nonprofit would be like another way of being able to band together, to share experiences, and to like have some kind of collective voice.
Mm-hmm. And so this is something that you're going to be keeping an eye on for quite a while. Is there anything else that you kind of want to add about this article and situation that you've dove into?
Not really. Just that insurance is a really complicated world. Medical stuff is very complicated. It's why exactly. I heard a lot of times when I asked, hey, why is this happening to the state? It's like, well, there's a lot of reasons why. It's not just one. So, I mean, it's hard to know how much has this audit system changed? Is this just a small subset of providers? I mean, when you have 28 and like growing people saying the same thing is happening to them, it's hard to discount them as just disgruntled people who made a mistake and don't want to own up to it. So yeah, it's just a really complicated system. But I mean, in terms of what I want people to know, I mean, I think just keeping an eye on like this legislation and you know. Yeah, I think access is just really important, and hopefully that trend of the rising Medicaid providers keeps on rising. I don't think anybody wants to see a dip in the amount of providers we have, but yeah, definitely something I will be keeping an eye on.
All right. Thanks so much for joining us here this afternoon, Chris.
Thanks.
Alrighty. Bowling's article, Finding Fraud in Nebraska Mental Health Pros Say They're Leaving Medicaid Over Aggressive Audits, is available on 1011now.com or flatwaterfreepress.org. For more news and updates, visit our website and follow us on all our social platforms. From our newsroom to wherever you are, see you on the next stream.